welcome back. Today we're going to show you some different treatment techniques, specifically looking at lateral elbow pain on the outside edge of the elbow, sometimes called tennis elbow, sometimes called lateral epicondylosis. Have a look at our blog for a bit more information. This is Sean. Sean's a builder, so a lot of repetitive movements, a lot of gripping, a lot of lifting and carrying. He uses the gym as well, so the whole time putting a lot of load through here, and now Sean's getting a bit of pain onto the outside of the elbow. That's right, isn't it? Yeah. Now if we do a quick test, we just put the extensor muscles on a bit of a stretch, and Sean's kind of getting a bit of resistance there, and that's sore. Yeah. Okay, so what we're going to do today is use the floss band. We get a lot of success with the floss band. We're going to put some compression around Sean's elbow with the band, then we're going to mobilise the tissue, and what it does is help to unstick all that fascia and muscle tissue that gets kind of tight and adhered in cases like this. So we're going to just take Sean into full extension, and we're going to extend his wrist, and this is going to be a little bit uncomfortable. I'm going to put plenty of tension on, and this is something that you can do yourself. You've got someone willing to give you a hand to wrap it round. Make sure plenty of compression all the way around that elbow, down to about mid forearm, then we're going to take it back up and around. There we go. Okay. It will restrict a little bit of blood flow. If you start getting a bit of a tingly, dusky hand, then just unwind a little bit of the tension. Alright, what we're going to do first is just take Sean's elbow through a full range of movement, just trying to stretch off and mobilise all that tissue around the elbow. Just watch for your shoulder position. We want Sean in a nice neutral shoulder girdle position. You're looking relaxed there, Sean. Okay, so we're going to take it into the corners. It's going to feel uncomfortable, and that's fine. Try and keep that that flexion on at the wrist, keep the wrist bent down so that we're getting a nice stretch throughout the forearm, and you can really be a bit vigorous with it. Take it right round and rotate it up, rotate it round this way, and don't be afraid to really get stuck right in. Once we've worked into extension, we're going to take him right up into his flexion movement. Again, just working around all those little corners of movement within the elbow that get a bit tight and sticky. You doing alright there? Yeah. Okay, when you're done, around about 2 minutes, as long as the hand is comfortable, we're going to unwrap and then we'll retest. Okay, let's take it into full extension again. Just say when it's sore, Sean.
A little bit now.
Amazing. Okay, so real quick improvement, dead simple technique. Have a go yourself. Exercise number 2 is seeking to improve the control of the muscles that sit around the elbow. So we're going to use the dumbbell in this position to control the wrist as it drops down. It's called an eccentric loading exercise. So first of all, we want our person in good position. So Sean sat down, forearm, as you can see, resting against the plinth. You can use a table, chair. Make sure your shoulder girdle is in good position. What we don't want is the shoulder kind of sticking forward. All right, so nice, what we call neutral shoulder position. Sean is going to take hold of the dumbbell. Manage that one?
It's about, mate.
Okay, he's going to get his other hand over the top of his hand, and then he's going to use the strength in this left arm to lift it right up to full range of movement. He's going to let go there and then slowly control the dumbbell on its way down. Good. Repeat again. Don't be tempted to curl the weight back up yourself. Make sure you use your other hand, take it right up to full, what we call extension, the wrist going right back, and then gently lowering down. Perfect. Repeat again. It's fine for it to feel a bit uncomfortable when you're doing this, and you'll feel plenty of muscle work when you're doing this. Working on around anywhere between 2 and 4 sets of up to about 20 repetitions at a time, so quite high volume with it. See how you get on. Okay, Sean?
Yep.
Crack on.